to another episode of the Health Priority Podcast. On today's episode, I'm happy to be joined by Dr. Nyira, who is a graduate student of Ghana Medical School and also have an interest in gastroenterology. This podcast is sponsored by eClinic Africa, making healthcare convenient and accessible. Dr. Nyira, welcome to the Health Priority Podcast.
Yes, thank you so much for signing up for the opportunity.
Thank you for coming. We met at UNESCO, right? That was our first time meeting.
Yes.
Yeah, so today we'll be talking about peptic ulcer.
Okay.
And I want my audience out there to know what it is and like what causes it.
Okay. So first off, I would like to show the audience that peptic ulcer disease, or many people refer to as ulcer, is usually as a result of a lesion that may be found in the stomach. So the common causes of peptic ulcer disease is either an H. pylori infection or chronic use of non-steroidal anti-inflammatory drugs.
So is the H. pylori, is it like a bacteria?
Yes, please.
Oh, okay.
Yes.
So like, do we have like a main cause? Like most people, like they think that, oh, when I have this pain in my stomach, that means that I have ulcer. So what actually like causes this condition?
Okay, so to know what causes this condition, we'll go a bit into the physiology. So the stomach produces an acid, hydrochloric acid, and usually this is used to digest some of the food that we consume. But at the same time, to protect ourselves from the acid, our body produces a mucus that is usually protective. So normally people who suffer from peptic ulcer disease, they're in that stage where there's higher acid production than the production of the mucus, which should protect them. So due to that, the acid wears away the layer of the stomach, and that is usually what causes the pain.
Okay. Yeah. So you talk of acid. Yes. So let's say I wake up in the morning and I take in an orange juice.
Yes.
And I like what's like here that they said is this acidity in orange.
Yes.
So but that's also like increase my risk of like getting peptic ulcer.
Yes. So taking in orange juice alongside taking other food or drinks that tend to promote acidity puts you at a higher risk of peptic ulcer disease, because particularly with oranges, there's citric acid inside.
Okay.
So, like I discussed earlier, if there's any case where there's a higher amount of acid compared to that protective layer, it would wear away at it, and then that's what will cause the pain and the other issues associated.
Is there any other foods that we eat like on a normal day that can like increase our risk as well?
Okay, so us normally being Ghanaians or even just Africans, we're known to have like a very spicy diet most of the time. Yeah. So with consumption of spicy foods, we also make ourselves more. Indomie, I wouldn't say so much, but just say like black pepper, shito, or like just very hot food.
Is it like something that will increase our risk of getting, if you continue to eat the black pepper?
Yeah, so if you continue to eat the spicy foods, they would put us at risk. And we have to, I would say we'll eat in moderation.
Oh, okay.
Yes. And I believe everything should be done in moderation. If you eat too much of it, it can have that effect, yes.
Oh, okay. So apart from the hot black pepper, any other spices like the Maggi?
So with that one, those are usually like seasonings. Yes. I wouldn't say they would do too much. But even apart from just spicy foods or certain drinks that promote acidity, other things that put us at risk: people who smoke, people who drink alcohol like excessively, or even people who they're on steroid therapy as well. Yes, they also have increased risk.
Oh, so when you said spicy, what came in my mind was the seasoning.
Oh,
yes, but the spicy mostly is the hot peppers.
Yes.
Oh, okay. Yes. So the hot peppers that gives us that increase our risk of getting the peptic ulcer.
Yes.
Oh, okay. Is there any like symptoms that when somebody has this condition it manifests?
Okay, so the first symptom, which is the main symptom that brings people to hospital, is abdominal pain. So it's usually felt nearer to the stomach, which is the upper left side of our abdomen, or even the central upper side of our abdomen. So it's usually felt there. It's normally of a burning sensation or a gnawing sensation. Yes, and this pain, it can be related to meals. Okay. So Now that I'm bringing it to this part, I will also kind of touch upon the types. So we have gastric ulcer and duodenal ulcer. And depending on these types, they have different presentations. So with gastric ulcer, you would have pain that is felt after taking meals.
After you take the meals?
Yes, please.
Oh, okay.
And then with the duodenal ulcer, you have pain that's relieved after taking meals. So because people with gastric ulcer, because they have pain after taking meals, that would lead to anorexia. They will feel the need to eat less, and it usually leads to weight loss. But should it be a duodenal ulcer, since the pain is relieved after taking meals, they would have weight gain because most of the time they would eat, and then them eating would relieve the pain that they're feeling.
Okay, so the duodenal ulcer, do you have any pain?
So you have.
It looks like when
So you
you
have
eat,
pain.
that's where you
So
are relieved
the
from
pain
the
is relieved, yes.
Oh, okay. But you still have the pain.
Yes. So the pain with duodenal ulcer, it will reappear hours later.
Oh, okay.
Yes, please.
Oh, okay. So both of them have similar symptoms, or both of them have different?
So gastric ulcer and duodenal ulcer, they do have similar symptoms, but these are the few things we can use to separate them.
Oh, okay.
And both of them also have nighttime presentation. So the pain can arise when you're sleeping, but it's less common with a gastric ulcer and more common with a duodenal ulcer.
Can you touch on the common symptoms that we have to know?
Okay, so so apart from the first one I mentioned, that was the abdominal pain, they would also be experiencing belching. So they'll be belching a lot.
Depending.
Yes, please. They also have indigestion, also from that dyspepsia. So with that, they would have abdominal pain that usually presents for about a month or more. It also presents with early satiety. So when they're eating, shortly after they've started eating, they stop. They're not able to continue. And then they would also have heaviness or discomfort after meals.
Okay.
Yes. And then yes, so the other symptoms too, because there are complications that may come with peptic ulcer disease, they could also be susceptible to gastroesophageal reflux disease. So most of the time you hear people say, I have reflux.
Okay.
That's what it is. And reflux, the most common presentation that they'll have heartburn.
Yeah.
So it's like chest pain. Yes, they can also still have pain at that site as well. It's very discomforting. Yes. So
mostly I see people in fact I hear them say that if I get J, the normal pain, yes, I mean it relieves the pain.
Yes.
How is this true?
Okay, so the normal G tablets that you hear people selling in the markets of pharmacies, that's usually known as magnesium hydroxide. Another drug also known as aluminium hydroxide. Some people also call it aloe drugs. So these are good antacids that can be taken when people have ulcer. They wouldn't necessarily help to take away the ulcer, but they will help with the symptoms. So the pain, the discomforting abdominal pain, it will help to relieve it because it comes to deal with the acidity.
Okay.
Yes.
There's this myth that people say that when you take milk, it can cure ulcers. Is that right?
So it is right and wrong in the sense that it has some truth to it because of the contents of milk, which is partly alkaline, so that will help with acidity. But it wouldn't be enough to just give milk. Yes, please.
Okay. Could you take us through some of the prevention? Just people out there will be aware that if I don't do these things, then I'm not prone to peptic ulcer.
Okay. So for the preventive measures, I would say that there's a non-pharmacological and pharmacological. So for non-pharmacological, as I mentioned, there is a need to avoid some of the common risk factors. So people who smoke, people who have excessive alcohol use, and then people who are on steroid therapy, they have to be very careful because steroid therapy can make them prone to going through this. Also the diet. So yes, diet as well, like the spicy foods, oranges, other foods that tend to promote acidity, they would want to control them. And yes, something we don't mention so much, but I think it's common for every Ghanaian, stress. So your psychological state, stress or anxiety, they can also promote this condition.
How does that promote this?
As to the physiology, I'm not too, but that is what I know that it can promote that. So I know it's hard, but we have to try and sit down and find ways to control our stress because we wouldn't want a case where we're extremely stressed and then it's progressing.
Then I'm sure bad eating habits, when we avoid that kind of
Yes.
attitude, it will also prevent us from getting peptic
having good eating habits, or even if you're not sure, wanting to get in contact with a dietitian, I think that's essential.
So can you take us to the different types of peptic ulcers?
Okay, so there are two main types, the gastric ulcer and then the duodenal ulcer. So for the gastric ulcer, this usually affects the wall of the stomach. So as I mentioned earlier, that is the upper left side of the abdomen. And with the duodenal ulcer, it affects the duodenum, and that's usually located centrally and upwards of the abdomen. I don't know if I could.
Might not see that.
Yes, we're not see, but if just to give a location of the landmarks, yes, please.
Oh, okay. Yes. So the gastro ulcers is when you get it after eating.
So
you get the pain. You experience the pain after eating.
So you experience pain after eating,
and then you don't know.
The pain is relieved.
Oh, it's relieved
after meals.
Oh, okay. Yes. So share your experience with us.
Okay, so with my experience on the wards, most patients who would come, they would want to rank the pain around like 7 to 9. And then the most common thing you hear them say is that, oh, my stomach is hurting me, or me for then you point to where it is. So most of the time, they give us the impression that the pain is very, very severe. Yes.
So for how long should somebody should endure the pain and say, okay, today I'm coming to the hospital because I've been in this pain for so long?
So I would believe that the duration would depend on the extent of damage. Because the longer the delay coming to a hospital to get you, the worse it gets. And I would say it's on their tolerance level. If they feel it's not that bad and they're managing, but I think when it gets to a point that it's too much for them, they will come. They will come. Yes.
Okay. So take us to the treatment.
Okay. So as I mentioned earlier, the treatment also is dependent on the two most common causes. So be it an H. pylori infection or chronic non-steroidal anti-inflammatory drug use. So I would say shortly for the chronic non-steroidal anti-inflammatory drug use, probably the best treatment is to find an alternative drug you can use to replace that one. Or it is somebody who, let's say, has been struggling with a particular condition, you want to go to a physician, get assessed, and know whether they can be put off. And then for the H. pylori infection, as we mentioned, it's a bacterial infection. So most of the time, they're given triple therapy. So the triple therapy, they're normally given 2 antibiotics and proton pump inhibitor.
But I'm sure with all these medications, you have to seek a professional.
Yes, you still have to see a health professional so that they would give the prescription.
So for you to get the drugs.
Yes.
Oh, okay. Mostly after 10 p.m., that's when it makes you nice. Yeah, so like when people buy these, they're like, I want plenty pepper. And you think that's like advisable for us because you are taking a lot of peppers. Like for me for instance, I like to eat pepper. So do you think it's advisable for me? Should I stop or I should limit it? Or this can also increase my risk of getting a peptic ulcer?
So I would say probably the best thing might be to stop, but also I would recommend more to limit.
Oh, okay.
Because yes, and per our culture we like pepper. Normally, so with people who not take Indomie around the times of 9, 10, but to around like 11 or 12. At that time, they will shortly sleep after. And then taking pepper, like having a lot of pepper in the Indomie, is not really the best. Just generally, and then even more at that time. Because of what pepper can do to the stomach. Yes. Because as I mentioned, it's something that spicy foods tend to promote acidity. And when you have too much acid, that's when away the protective layer. That is when you notice that okay, the damage starts, and then that get down the road. So I don't know. So,
Okay.
yes.
So, with just the symptoms, can I just diagnose myself that I have Peptic Ulcer? Or how do we diagnose this condition?
So, from what they've taught us, the history does help,
Oh, okay.
and then examination also helps, but there are certain investigations you'd also have to do to confirm.
Is that the endoscopy?
Yes, so you can do an short name EGD or an upper GI endoscopy.
Okay.
So it would view through the esophagus, through the stomach, and then all the way to the duodenum.
So it's like they will insert a camera.
Yes.
To view all those things so that you can diagnose them.
Yes, and it's important that that is done because most people would want to narrow it down to I might have ulcer because of the symptoms. But in fact, there are differential diagnoses, of which some can be malignancy. So that's the usual concern. So by doing an endoscopy, you give yourself the chance to actually view the lesion, and then most of the time, a procedure that is done is a biopsy. So they just tend to take off a chunk of the affected lesion and they'll test it to confirm whether it might be a malignant tumor or it is just the ulcer as it is.
Okay, so like recently people have been on weight loss.
Yeah.
And I mean they scroll on TikToks or other social media platforms, they see people on weight loss journey and some will go like, oh, I follow this person now, I have ulcer. That means the person can just sit behind the camera, okay, or follow the procedure of the video that he or she saw and say, okay, I have ulcer, unless the person is examined before.
Yes.
Oh, okay.
Yes. And the thing is, for people who want to follow some of these fitness influencers online, and then you have a negative effect, we all have to realize our bodies are different.
Oh, yes.
And because our bodies are different, it reacts differently to certain things we might do for ourselves. Some might not have a negative effect. Some might have the worst brunt of it. So I would say with those things, people have to check carefully. And there's a lot of medical misinformation online, especially in our time. Sometimes from like our parents or uncles and aunties. So even personally, I always tell my mom that she should tread carefully, like with some of the things they share. Because some of these diets, and sometimes they share health tips.
Oh, yes.
They promote or they preach to certain health conditions that are dangerous. I would say that not only should you learn from this, but self-medication, I would discourage it, just generally. Sometimes you never truly know what might be worrying you, and even some of us doctors do it as well. But there's a need to go to the hospital, sometimes doing certain tests just to be sure. Because you never know what can save you because you made that step instead of wanting to treat yourself if you see familiar signs. Yeah. Thank you.
Thank you so much for giving us more insights about this.
Thank you so much, Mr. Etta, for the opportunity.
Thank you to all our listeners and to everyone who has subscribed, and follow us on all social media platforms, the Health Prides Podcast. Catch you next time. Bye.